This little video is going to be on air pollution. If you live in the Salt Lake Valley, air pollution is a real big problem, particularly in the winter. The problems that I see are patients with respiratory disease, particularly rhinitis or inflammation of the nasal airway, and asthma, which is inflammation of the airway into your lungs. Asthma is really just asthmatic bronchitis. When we say itis in medicine, we mean inflammation. So asthma is inflammation of the bronchial airway, and rhinitis is inflammation of the nasal airway. We have allergic rhinitis, we have allergic bronchitis, which is kind of asthma, and we have infections causing inflammation in both the nasal airway, or allergic rhinitis. Some people call that hay fever, or it doesn't have to be seasonal, but that's the common term. Or allergic bronchitis, infectious bronchitis would be your lower airway in asthma. Now, there's a third thing, major category, that causes inflammation and even more irritation, and that is irritant inflammation. Now, the allergens and infections tend to cause a lot more inflammation. Irritants really irritate an inflamed airway. I tell people it's kind of like pouring chlorine on an abrasion. People with asthma or allergic rhinitis have inflamed airways, and when they are exposed to irritants, it really exacerbates that inflammation. In the case of asthma, in addition to making the inflammation worse, it causes spasm of the muscle around the airways. And the winter's a big problem in the Salt Lake Valley for inflammation of your airway with all our inversions. It's pretty hard to get away from them. The best way would be to get on a rowboat and paddle out deep into the ocean. No irritant pollution out there, no allergens out there, and no risk of getting respiratory infection. If you take a cruise ship, you'll probably come back with some kind of respiratory infection. But since most of us can't do that, go on a little sailing trip, we're stuck here. What should we do? It's always best in medicine to avoid a problem if you can. So if the pollution level is really high, then you probably want to stay out of it as much as you can. And as you probably know, the EPA sends out alerts when the pollution level is high. A yellow burn is the phrase for a mild to moderate amount of air pollution, and when it gets high, it's called a red burn. So what do I recommend? Well, I recommend when it's a red burn, the people with asthma in particular stay inside as much as possible. Now, I'm not saying you have to become a hermit, but you don't want to go for a jog outside or send one of your children out to recess outside if it's a red burn. In general, it's not a good idea, but particularly if you have asthma or a lot of problems with inflammation of your upper airway, rhinitis. What are the pollutants that are in the air in Utah? Well, the major ones are particulates. I think that's probably the most irritating thing. Those are little tiny microscopic particles in the air, mostly from exhaust and burning fossil fuels like wood burning stoves, cars, that kind of thing. Those particulates are very irritating. Probably about as irritating as anything is diesel exhaust. In experiments, people don't have to be exposed to very much diesel to trigger off an asthma attack if they're asthmatics. The second big category is ozone. And ozone is in the air in the winter. It's very high in areas like Los Angeles. It gets high here occasionally. And ozone is very irritating. It is a molecule which has what's called free radicals, if you want to get fancy. And what those do basically is they tear up your airway when you breathe them in. And then the third big category for outside air pollution is sulfur dioxide, which is also produced by combustion. Now inside, more of the pollution from combustion is nitrous oxide. That's produced by gas flames, your cook stove, etc. That isn't as irritating as those others that I've talked about. And of course, carbon monoxide can be produced, and you don't want to have any of that. That can be an outdoor and an indoor air pollutant, but if that gets high, it'll kill you. So you should all have a carbon monoxide detector in your home, which is working well. Now, what else can you do besides avoid these things? Well, the next step is to take medication if you have to. And the medication that are type of medication for respiratory disease that works best for inflammation are steroids. And people go, oh, steroids, that's bad. But inhaled steroids that have been developed are not bad. They're really good. The therapeutic ratio, that's how much good it does for the amount of risk, is real high on the good side for most of our available inhaled steroids. And we refer to this as low-dose inhaled steroids. If you get above 1,000 micrograms a day, then you might start to have a big concern about side effects, but very few patients are on that much. They're on much lower doses. And those steroids are anti-inflammatory. There are really no other medications which are in general used for asthma that are anti-inflammatory like steroids are. There are other medications that are anti-inflammatory, but they have too many side effects. And they are used in medicine for certain things, for graft rejection, for cancer, for arthritis. But in respiratory disease, such as asthma or rhinitis, the main inflammatory agents are inhaled corticosteroids, and they're the only drugs that have been proven to save lives and decrease morbidity. That means hospitalization, emergency room visits, or the use of systemic steroids, which would be like a steroid shot or a steroid pill. Just a short course of steroid systemically with pills and shots overwhelm and cause a lot more side effects than an entire year of inhaled steroids. So I tell patients to think of inhaled steroids as the anti-steroid steroid, because if they're keeping you from having to use injections or pill steroids to control your symptoms, then they're reducing steroid side effects, not causing steroid side effects.